Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
So that your brain can get those signals, and that this is likely to prevent you from getting dementia because the sounds that your brain normally is used to hearing, you're no longer hearing, and so that part of the brain may atrophy and may make you more likely to develop dementia. So that's what you need to tell your patients, and you tell your colleagues who you keep saying, they keep saying, "What did you say? What did you say?" As I did for a long time. And when your friends tell you that maybe you need a hearing aid, listen to them and get a hearing aid, and the likelihood of that being a cause of dementia in the future is decreased. Any other thoughts or comments relative to the message of this article?
Yes, many people think that they're a little hard of hearing or they have a slight hearing loss, and often it's much larger than you think. I thought I had a 20% hearing loss. I got tested, and it was 50% in both ears.
Yeah, that's what mine was.
Yeah, so they recommend being tested. Have your hearing aid tests are generally free. And you get them done every 2 years.
Yeah. It's pretty painless.
Yeah, I have a brother who's in denial. He has hearing loss. And he said, my hearing is a little off. He won't go see about it. And you would think with Chris as an example, he would take advantage of it and at least go to the doctor. But I think I'm going to share this with him, and hopefully that will make a difference.
Yes, good,
Mhm.
good, good.
I have, my godmother is in her 90s and she has a hearing loss, but she has hearing aids, but she just doesn't wear them. So I don't know what.
What good is hearing aids if
I
you don't
know
wear
it. She just does not wear them. And she'll holler at you but she won't wear those hearing aids. I don't know why.
Well, you get what you pay for. Some hearing aids actually sound terrible, and people don't want to wear them because they don't like the sound coming through their ears. But you pay a little more money, you get better hearing aids, and you can get them where you like the sound and they're comfortable. You wear them all day long, and you actually feel like a fish out of water if they're not in your ears.
Yes, okay. Maybe you need to give me some makes that maybe a higher quality, and I'll tell her caregivers. She definitely just doesn't wear hers.
Well, the
And
mix are going to be
no,
different for everybody. Everybody has different hearing needs. Like for me, I could have gone with a make that would have emphasized conversation, but since I'm a musician, I need something that I can do conversation and music, and so I don't get as good conversation, slightly less conversation, but great music. So it works for me.
Mm.
But everybody's going to be different. But you just need to at least try
Mhm.
2 or 3 different pairs and see what works.
Dr. Perez?
I think it was 2023. It might have been as early as late as 2024. The requirement for hearing aids and the need for health professionals to be involved in the diagnosis and the prescription for the hearing aids has been removed. And again, like direct to consumer advertising, decisions about hearing aids, though the cost has been reduced, the pathology and the need, whether conversation, music, all of those things now the consumer is responsible for making those decisions.
Yeah. That's
Yeah,
true
and
because, yeah, I was getting ready to say that is true because her nephew is the caregiver and he takes her where he wants her to go to get the hearing aids. So,
right, and they have all kinds of hearing aids. And one of the things that happens if you have a otolaryngologist or audiologist working with you is that they can modify the hearing aid and they can help you adjust it so that it can be satisfactory. Whereas if you just go and get a hearing aid and use it, you may not be optimizing its use. Any other comment? If not, we can go to the next article, John. Jacobed, you've joined us again. Good to see you.
Thank you. It's good to be seen and it's good to see everybody.
Uh,
Let's go with the next article.
Oh, this is an article on dementia. This is something that looks at all of the 14 modifiable factors that are associated with dementia. You can see them all here: cigarette smoking, excessive alcohol. Some people argue with me that it shouldn't say excessive alcohol. It should say no alcohol. But that's the medical perspective, is that it should be excessive alcohol that is the issue. Lack of moderate exercise, obesity, uncontrolled hypertension, high, this is a relatively new one, high cholesterol level, uncontrolled diabetes, social isolation, untreated vision loss was added, as well as we always knew about untreated hearing loss, untreated depression, brain injury, and those people who engage in sports should have brain protectors. Low educational attainment was something that I thought was an interesting statement, as well as air pollution, because often it's not much we can do about the air pollution except to have filters in the house. And low educational attainment is an interesting addition. Now, this is something that you all know, because we've discussed this many times. Most of the foods that are available have detrimental effects due to the addition of harmful substances included to make them more tasty. So we listed the following foods that are recommended in preference to others, and that is fish, vegetables, whole grains, fruits, and nuts as well are preferable to the foods that should be avoided. As you scroll down, you see the foods that should be avoided, which are white bread, sugar, processed meat, processed cheese, microwave popcorn, alcohol, refined carbohydrates, foods with trans fats, highly processed foods, foods with monosodium gluconate, and fish with high levels of mercury, and then margarine. You can see that maybe that's most of the foods that you like, but those are the foods that contribute to dementia. So I think we conclude that to reduce your risk of dementia, you need a well-balanced diet with plenty of fruits, vegetables, and nuts. Very little processed meat or anything like that. And in addition to that, of course, the exercise and the meditation aspects of it that are very important. And I think that this is kind of an opportunity to share with others the good and bad, and ugly of what we're doing to help or increase the likelihood of getting dementia. Any comments, or would you go down to the conclusion of it, John, so we can emphasize the bottom? Yes, yeah, that's it. That's the. Now, I didn't say much about the mental gymnastics that you can use as well. That's what the conclusion slide talks about: chess, bridge, and puzzles, and there are many other mental gymnastics that you can involve yourself within. Any comments or additions to?
Dr. Callender, I have a part where this says low education. As we know, a lot of educated people have dementia. And one start off when we talked about our president, Reagan. And I'm sure he was reading a lot. So I don't know how they came up with the low educational factor that caused that people have dementia.
Well, they looked at the people who have dementia. They looked at people who have high educational attainment and those who had low. And they identified that those people who had low educational attainment were more likely than the others. That's why they included that. That doesn't mean that because you have high education, you won't get dementia, but it just means that there's that association.
Dr. Callender,
Yes.
this is Sylvia. Good morning, everybody. I thought with Reagan, they knew he had dementia, but the people, around him was actually trying to hide it. So, it's important, that people recognize it and deal with it. But in this case, the way I heard, they dealt with it, just trying to keep it subdued. So, I think that was his problem, or at least it was mentioned that he did have it, but the politics of it all was hiding it all. So I was just saying that to say those around us, it's important that we, do something about it instead of just trying to hide it.
Yeah, Ronald Reagan was a notorious sugar junkie, jelly beans all the time.
Okay. Any other shared comments?
I feel like with Reagan too, that he probably was getting treatment for it, but they just didn't want the public to know it. And I think he was being treated as best they could, but they just
I have a problem with that. I've known several people that I didn't know if the family was in denial or what. The Black race, and some of them had leadership position, like one was a pastor. Nobody mentioned that they had dementia or Alzheimer's. Everybody had a sneaking suspicion that they had it. In fact, I know of 2 pastors that had it. They weren't relinquished of their job, their family, like they were in denial, but everybody was whispering they might have it. So, and then I know just common everyday people, nobody says it, but they just sort of act like it's invisible. And as far as treatment, they had these pseudo drugs that said that they treated like my mother, but they really didn't do anything for it. I don't think they have a cure or a treatment for it.
Not yet.
They can slow it down, but
that remains to be seen. How much they can slow it down, because if we had good treatment, you'd be aware of it. But the treatment that we have is necessarily significantly better than anything else. So that's why you don't hear any talk about a cure. And that's why it's so important, if you have relatives with dementia, to try to support them and help them, keep them from hurting themselves and others.
Well, what do you do when people have high positions? Does one person speak out and think they have it, or they act like you shouldn't say it at all? Like I know two pastors, and nobody said that they should relinquish their position.
Well, you know, what is interesting in the churches is that the pastors believe they have those jobs for life. And so it's difficult for the church members to get rid of them. I know a number of pastors who fit into that category, and they've held on to their jobs. And that's why you see this development of this so-called executive administrator who then kind of takes over for them. But that's another way of hiding, doing exactly what you commented about, instead of addressing the fact and recognizing that the pastor is demented. They then create another position so they can still stay in that position. So this is not something that we've learned to effectively deal with. One might argue that what they did with Biden was one of the best things that anybody could, since there's no effective cure or treatment of dementia.
So,
Yeah,
Dr. Count,
the caregivers have to know something about dementia so that they can help support them.
Absolutely, absolutely. Sylvia?
yeah, so, I was just thinking, so, how COVID came and it was a global crisis and every country, pulled together to find some type of solution. Why is it not Alzheimer where the same thing is happening, knowing that this impacts so many countries? And I don't know where the World Health Organization stands on this. Do you know where they stand on Alzheimer's?
They have not come out and said anything about it, but I think your point is well taken.
Mm. Okay.
Jacobin?
Callender, I want your thoughts on these various games, especially the word games and things that people talk about, especially those that are sedentary and that are at home all the time and not really engaged in activities or whatever. Do you think that these word games are helpful in slowing down the process?
Yes, there's evidence that, of course, one cannot replace exercise because you need
Right.
to have moderate exercise. But it is clear that those mind games play a role in increasing your cognitive abilities and delaying the onset of Alzheimer's, so that chess and bridge and puzzles and those kind of mental gymnastics are helpful. And of course, there's some articles that talk also about, which we share also, which talk about music and how music plays a role as well. So there are a number of things that you can do along with the exercise that will slow down the process of dementia. And we recognize that 80% of the dementias in older people are Alzheimer's.
Last week we were talking about that the most highly developed countries had the highest rates of dementia and Alzheimer's, and that lesser developed countries, what we call third world countries, where they don't have word games, chess, etc., they did the best with dementia. So it seems to be more of a lifestyle issue, what we eat and levels of pollution.
Much evidence to that supports your position. Any other comments?
Dr. Callender, sometimes it's hard to tell the difference between early onset dementia and just regular old age. memory loss from '08.
Yeah, and it's pretty clear that dementia is not a part of the aging process. Having some memory loss is, but a dementia that interferes with your activities of daily living is really not part of the aging process. Dementia is a separate entity, and it is true what your commentary that sometimes the early onset dementia may be confused with the memory loss of aging. Dr. Perez?
And I think the issue of relationship and remaining connected is very important, whether we hear, whether we're part of community, whether we're stimulated by conversation and responsibility. That's also important. And I think it reflects socioeconomic status, first world versus third world. All of those things, I think, are related to the issue of relationship and how important it is that we remain connected to one another, oneness.
Any other comments you want to share?
Yeah, I like what Dr. Perez just said because in those so-called third world countries, there's households are generally intergenerational. You can't get lonely because you're surrounded by people. In highly developed countries, loneliness is a real thing.
Mm-hmm.
A lot of single family or single person households. There's a
Mm-hmm.
lot of isolation in our so-called developed countries.
Any other sharing? Excellent points. Okay, let's go to the next one, but thank you for sharing those very important aspects. This is an article that was occurs because there was a thought at first to be an association of COVID vaccine and multiple sclerosis relapse. This new data identifies that the use of the COVID vaccine is not associated with multiple sclerosis relapse risk. And this is important for those patients who have multiple sclerosis and are undergoing treatment because it's another autoimmune disease that is important to be sure that taking the COVID vaccine does not make your multiple sclerosis worse. Nowadays, we have injections once or twice a year or so that monoclonal antibodies that are able to keep the multiple sclerosis in check. And so so it was important to share the fact that after looking at most of the data, it appears that the COVID vaccine is not going to cause a relapse of the multiple sclerosis. And that's what this article is all about, to try and let you know that the new data that has been studied says that you can safely take COVID vaccine even if you have multiple sclerosis and not be concerned about a relapse.
Does it make any difference whether it's long COVID or not?
Well, they don't. They just say that it is not associated with taking the vaccine. Is not associated with relapse. They don't address long COVID at all. Because their emphasis is on the vaccine, not on the type of COVID that you have. So that would require another study. Okay, let's go to the next article. Got some interesting articles, 24 articles that address some very interesting topics. This is an article that is geared to look at, there are no freestanding hospitals anymore. Howard University Hospital used to be, Georgetown Hospital used to be, George Washington Hospital used to be. All those have been taken over by private equity firms. And what the data is saying is that most of the time these people take over these hospitals so the investors can make money, not so that the hospitals can be saved. And so that when the long and short of the story is that investors take over to help the investors, not necessarily to help the hospitals, although you'd like to have a situation in which both issues occur. That is, the investors make money and the hospitals also improve the quality of care that they give. But so far, it's clear that the private equity firms take over and they make money for the investors. There's not much that identifies that the quality of care is particularly improved. That's what this article is saying, that yeah, they may save troubled hospitals. Sometimes they do, sometimes they don't. But in terms of improving the quality of care that the hospitals give, there's little evidence to show that that is the case. That's the long and short of this article. As you look at
Dr. Callender,
yes,
maybe the investors' healthcare that improves when they see all that money coming to the bank.
yeah, well, okay.
Betty has her hand up.
Shall I
Black.
go?
What you say, Carol?
Betty's hand is black.
She was, yes, it is. But what I was going to say was that is so true of this article, because I don't know whether anyone else heard it on the news last night, but the hospital in Southeast, the old Southeast hospital on Southern Avenue, just yesterday closed. And it was the investor.
Which hospital?
United Medical, the one on Southern
Oh,
Avenue.
yeah. There used to be Cafritz.
Yes, Cambridge, yeah. It just I heard it on the news last night. They shut it down. So,
good example. Yeah, you're right.
Yeah, very good example.
What really bothers me is these hospitals changing up executives and getting new equipment and so forth. I like the new equipment, but they don't seem to train the employees who have to operate the equipment sufficiently, and then they get all bent out of shape and don't want to have the person continue working, and so they either fire them or put them on a lower level of work. And it seems that the patient is not recognized in the improvement process, because the patient care goes down the drain while they getting all of this new equipment, all of these new fangled things. And you know how old I am talking about newfangled. But anyway, it disturbs me that the patient care does not equal the advancements in generally speaking.
Thank you for sharing, because that's kind of what this article is all about, saying that the patient, where the patient fits in the equation is less of a factor than it should be, which is your point. Yeah. Any other comments on this?
have we abdicated our responsibility? You know, south of the Mason-Dixon line and really after Medicare and Medicaid, our hospitals that were segregated, they were supported by our churches, by our community. And now our impact and our responsibility for them is disconnected. How many community advocacy meetings for your local hospital have you been to? And because we're not voicing our opinion, we can't expect to see a change.
Well, I agree with you on that. Community involvement is precious when it is directed in the right direction. But if you don't know until maybe you get sick or have to go to a facility for whatever reason, uh, uh, it, you're not really exposed to what is going on. And I have been exposed because of my caregiver notions, that I've been in many hospitals and many situations where the care is so computerized that you hardly ever get people putting their hands on you. Uh, it's just remarkable advancement, and I'm certainly for advancement. I would shudder to think if we were still in the old days of segregated hospitals, but we haven't kept up with the advancement.
Any other commentary? It's a very good conversation and points of view that are very important. Any other ideas you want to share?
Thinking again about the hospital in Southeast, I know the people in that community were very vocal about that hospital and have been for years. Get medical, better medical care out there. And they are in the process of building a new hospital out there on the St. Elizabeth site, I believe.
That's
but
correct.
It's not going to open until next year sometime.
That's correct.
They're still stuck in the meantime with no hospital out there. So the community was involved. I don't know how it slipped through the cracks, but it did.
Well, you might argue that the fact that you're having a new hospital is an evidence that it didn't slip through the cracks. We shall see what happens with this new hospital in Southeast. Any other comments? If not, we'll go to the next one. Got some exciting new articles. We haven't gotten to any of them yet that I'm looking for, but there's some breakthroughs that. But this is an article on that I will sum it up that shows that nurses on flights and doctors on flights deal with crises in flight that require them to take advantage of their expertise and use it to help situations. This particular customer on the airplane fell, and an older gentleman fell and hit his head and suffered a laceration, was bleeding, and took two nurses to work with them to stop the bleeding and help the incident. So as professionals, volunteering to help when those crises occur is something that we actually hold you harmless and will not have you victim of a malpractice suit because you help and you aren't able to stop the issue. But this is a situation where the professionals acted professionally and were able to help this gentleman who was bleeding. That's the long and short of the article, and I think that it's something that is, it used to be a time when if you were a physician or a nurse and you helped out, you could be sued. Nowadays, that's not the case. You help out, you do the best you can. There's a little likelihood that you could be involved in a lawsuit. They pretty much hold you harmless. Let's go to the next one, please. Yeah, we're glad that Fauci, the question with Fauci, who developed this West Nile virus, is how he got his West Nile virus here in DC. But he has been hospitalized and is recovering at home. The question is, how did the mosquito from West Nile get here in DC? But be that as it may, he's at home recovering and is expected to have full recovery. And there really isn't much treatment for this particular virus. And so he was diagnosed early and treated, and now he's recovering. Let's go to the next article, please. It's interesting, he lives down the street from John Buchanan, so it makes you wonder about the mosquitoes in that area. Yeah. This is an article on hand sanitizers. As you know, they contain alcohol, and there's a concern that this may lead to alcohol and people drinking the sanitizer. Alcoholics can drink a lot of alcohol containing. And so the article wants you to keep in mind that this is also another source of possible addiction. Hand sanitizers used properly are very effective, but when people abuse this, then that is a problem. Now, most of this that they're talking about is not occurring in the United States. This is in Germany and other places, but it is something that there's an article that talks about the fact that this a situation in which people who are alcoholics can abuse the alcohol sanitizers. Let's go to the next article. Yeah, this is an interesting article that talks about death bots. That's something that may be new to some of you, but it's a situation in which you take your loved one's voice and use that voice to educate the rest of the family about a lot of concerns. And the positive aspect of it is that you have the loved one's voice to remind you of how things used to be. And this is the positive side of it. The negative side of it is in the ethical concern, is that they may take your loved one's voice and use it for things that the a loved one never intended them to use it for. And so this is what the ethicist is concerned about, the fact that, yes, it's a good thing for AI to take the loved one voice and use it for things they gave permission for it to be used for. But there's the possibility that they may abuse it and misuse it and have them talking about the AI voice talking about things that the loved one had no desire to talk about. Sylvia.
Yeah, when I was looking at this article, I don't think I remember. Did it address like the grieving process of the individuals, to
No,
prolong?
it addresses only the fact that it was intended to be used to help the grieving process. That was the intent, to help the grieving process, because you still have the voice of the loved one. So that was the intent, to use it in that fashion. But the ethicist was concerned that they might take the voice and use it for other issues which it was not intended for. So that initially it was used to help the grieving process, but the ethicist was concerned that it might be misused and abused. Betty?
Yes, I'm still leery of AI, but my thing is, what's wrong with the old-fashioned process of just recording what you want and giving it to your family members, as opposed to trying to do something with AI? Why can't you just record what you want to tell your family and give it to them, or leave it?
Makes sense. Makes sense.
Yeah, in that case, there's not much difference between using a regular tape recorder
Amen.
and then having AI do it for you. They're very similar because
The difference, John, is you have control of a tape recorder.
AI, you may lose control, and God only knows what they'll have that voice saying.
yeah, AI takes
Yes.
control.
Jacobin, you?
No, I was just agreeing with Betty. I'm kind of old fashioned, and I haven't introduced AI to my psyche yet.
Sylvia, any other
I was
comments?
I was going back again, thinking about the grieving process of the individuals who are listening to this over and over and over again, listening to this voice. And I was thinking, does it help the individual who, is, still trying to get over the grieving process? They sit there and they just listen to the voice over and over again. I guess I can't see how it really will help somebody who is still grieving and all they want to sit there to do is just listen to the same voice and just not get through the grieving process.
Any other comments?
Dr.
Donna?
Callender, where can you purchase a tape recorder and tape these days?
Tape recorder?
Yes. Do they still sell them?
Yeah, well, recording, well, when you say tape recording, you mean specifically tape, because they have recording devices.
Yeah, they have recording devices, but tape recorders, I don't think, are no longer sold.
Yeah, but I think they're referring to recording devices.
On your phone. So if you don't pay for your phone or you lose your phone, you don't have it on your phone. Our devices on recording these days they're limited. They're not like tape recorders used to be.
Right, but they do have recording devices.
Yeah, you can buy cassette recorders and reel-to-reel tape recorders on eBay. The problem with cassette tapes and reel-to-reel tapes is that they fall apart over a period of time.
Right.
They got a lifespan of about 10 years. After that, they're pretty much dust. But you can always record things on your phone. When you say, what happens if you lose your phone or trade it in? You can upload those recordings to whatever cloud, if it's Google Cloud or iCloud. So yeah, you can record it on your phone, upload it, if you want to do that.
And they have the little other things too to record on.
Thumb drive.
Thumb drive. There you go. Thumb drive.
Yeah.
I'm not a fan of the cloud either.
Okay, we're ready
I
for,
like that paragraph that's highlighted. And I think that leads to what Sylvia was talking about. You know, listening to your loved one's voice over and over again,
Yeah,
what they
yeah,
used to say, that is not a good way, I don't think, of grieving. It's just like it's keeping you in that one central level of not accepting their passing.
yeah,
Yes, and I agree that that's especially if you are, listening to the will over and over again.
it all depends on what you're listening to.
Yeah.
Yes, it
Because
will.
you
Yeah.
might want to listen to your loved one singing a song, and that might be comforting. So it all depends. It all
Yeah.
depends.
Yeah,
I'd vote against listening to, the details of the trust over and over.
Well, that to me, that's a different issue.
Yeah.
But I mean, for example, listening to music from somebody you love is the same thing. You know, Luther Vandross, been dead for ages, but you listen to his music, it's refreshing, and it's not it doesn't negatively impact the grieving process. But this paragraph does address a negative aspect of it.
I like the new golden rule that Tim Wall said. Rather than do unto others, he said, mind your own damn business. So when you're voting for how you want to grieve, just vote for yourself. Let other people grieve the way they want to and leave them alone.
hmm
Yeah, but recordings, you can record and not even listen to it till years later. Once
Yeah.
you dealt with the grieving,
Yeah.
you still have that. I know I have plenty old tapes and cassettes and stuff of my mother's voice at her 90th birthday party, and I listen to it from time to time. So
Yeah. It's all
Yeah,
your
you just don't want it to wind up in court. That's all.
John.
Any other comments? If not, we'll go to the next one. I know Joyce has to leave in 7 minutes, so try to do as many as we can before she leaves. This is a very helpful article that talks about how playing an instrument improves brain health. And since there's so many musicians here, it's interesting to see how they have looked at brains scans and other brain waves to see how playing music affects the brain. And all of it seems to be very positive. What I was interested in was that the type of music that was the most helpful. And there's several articles that John has included in here that address this. If you scroll down, you see the actual types of music that the study reveals. And it was interesting that playing the piano was of the most value. So, Carol, you beat everybody else. Okay. And of course, the woodwinds and the brass, John, and the other things are good as well. But apparently, piano tops the scale of everything else. Singing is helpful also, but it's not as beneficial as the piano playing. And then, of course, starting afresh with an instrument is also beneficial to the brain in many ways, just as learning another language is helpful. So music is a gift that keeps on giving in many ways. And so while music is therapy for those who are ill, it's also therapy for those who are musicians. So it's a very interesting article. Any comments from you musicians and educators relative to this article?
Yeah, Carol won't let me buy a new instrument.
I'm saying this is a good article. Daryl's also a pianist. And sometimes, and John, he'll just sitting up there listening to music. And Daryl, he likes to do that too. Analyzing, focusing on the music theory, tell me what chord progressions. We'll go to concert and he says, okay, can you hear the chord progressions or something like that? And I'm saying, I'm just listening. But that is one thing about music theory, theory and etc. That does help your mind if you want to focus on it.
Any other comments? If not, let's go to the next one, please. The article that I was hoping to get to before Joyce left was the one that talks about the fact that you no longer need to have a vaginal speculum for pap smears. In the past, every woman would have to have a vaginal examination and a speculum placed in the vagina to actually have a pap smear. We have progressed to the point now that you don't need you don't need a vaginal speculum. They've got to the stage now where they can isolate vaginal secretions and actually be able to find out if you have cells that could be cancerous or precancerous, which is a major development and something that is really bringing in a new era in which there are circumstances in which a vaginal speculum would not be necessary for a pap smear. So that's a new breakthrough that is in many ways wonderful for a woman, but it's something that you'll read about in many articles, but this is the first time that has actually occurred. Now, this is another low HPV vaccination is a public health failure. And this is something that educators are well aware of. The fact that only 38% of the population has had, of these people in school, have had HPV vaccinations. It's actually a disgrace. And the fact that it's not close to 100% means that more women will have cervical cancer and die from it. And this is actually a preventable disease. And so that is why this article talks about the HPV vaccine as a public health failure, because all students, male and female, who come to school should not leave school without having HPV vaccination. And then those people who get out of school without having it should get it later on. And so to say that only 40% of the population has received an HPV vaccination is a public health failure. And that's what this article is all about. And so it's important to be sure that your kids who go to school, that they get the HPV vaccination, males and females, because the males are the ones who spread it, and the females who die from cervical cancer. So that's why this article is all about the fact that since we know that cervical cancer is curable by this vaccination, then we should have better than a 40% success rate. Any comments on this?
But we don't believe that teenagers are having sex.
We know they are. We know that the preteens are having sex.
Believe they are, and we know they are.
We know they are. They're getting pregnant all the time. That's proof of it.
One of the ones we don't know about are the ones in the senior home. They can't get pregnant.
Well, right now there's a lot of skepticism.
You know, one of the shocking statistics is that 1 million people every day around the world are getting sexually transmitted diseases. So it isn't that we don't know that they're having sex, it's that we're not giving them the vaccine. Daryl, go ahead and say what you had to say. I'm sorry.
Yeah, there's growing skepticism about all vaccines, and vaccination rates are falling. There's a lot of conspiracy theories that vaccines will increase autism and a variety of other ailments. And, they're piggybacking on women's reproductive rights, where the slogan is "My body, my choice." And so people are saying about vaccines, "My body, my choice." And it's, it's like apples and oranges, because vaccines are for the overall public benefit for contagious diseases. You're trying to prevent contagions within the community. It's not a matter of my body, my choice. It's protecting the overall public good. But until we got a lot more positive advertisement to convince people that vaccinations are a good thing, you're never going to get traction with the HPV vaccinations and other vaccinations.
Any other comments? Very important.
I have to bring in voting here. It is very, very important, especially since Project 2025 aims to get rid of even polio. So we're getting to a point where we have to say, as the next president of the United States said, we're not going back.
Any other comment before we go to the next article?
The thing about it is reaching parents of children of this age group there and telling them that their children are having sex. Certain populations, they don't want to believe it, or they're in denial, or you just saying, it's not my child that's having sex at this age because I'm watching it, etc.
Your child.
It's hard and I could say, even for myself, to think there's a possibility that my child is having sex at 9 years old. That's a hard pill to take for a lot of parents, including myself. I don't know if anybody else would feel that way. If your children, you're in the library and you're thinking your child who's in the 4th or 3rd grade is having sex, and you see them home every day, and you think you're having that. How do you, communicate that to parents?
Not my child.
Yeah. Children become teenagers. Teenagers become adults. The fact that you had them meant that you had sex. So we're talking about, we have got to have the mindset that this is going to occur. And we want at the time that our children have sex, that they are healthy and not spreading HPV. So we have to take on that mindset and be educated to that. Having sex over the last 50 to 75 years, the age hasn't changed. It happens. It happens. That's why our numbers keep growing. People will have sex. It's part of the life cycle, like breathing. So we are going to protect them from a disease.
Well, my thought on that situation is, I know we're all older on this call, but if you can go back in your mind to when you were a teenager and what your thoughts were, you might not have engaged, but the thoughts were there. So sometimes, young people give in and sometimes they don't. But the hormones and everything
Yeah.
start as a teenager. So,
And it's important for us more senior people to let younger people know it's going to happen and it's okay. It's okay. Let them get the vaccine. We got to tell it's okay.
It's by
But
design.
our culture looks down upon parents and children, especially when girls get pregnant out of wedlock. Even the terminology is degrading. A mother who lets her child, her daughter particularly, run around and have sex, it's your fault. It's just like it's your fault if your child builds a bomb in the basement and you have no idea what's going on in your household. Most of the thing, it comes upon the parents, particularly the mother, that got to take the brunt of their child going out having sex. And one thing's mothers used to brag, I had all girls and not a one of them got pregnant before it was time. That was a badge of honor. And all of a sudden, you're going to think we're going to change our culture. Churches used to, make girls come in the front of the church and then excommunicate them. I got pregnant before I got married, or I had sex. Even in the scriptures, a woman that was caught in adultery, they never talked about the man. And now all of a sudden, we got to get them vaccinated because we know they're having sex because they have been having, it's our whole mindset. This is not okay. It's could be a little bit more realistic because we no longer take them in front of the church and have them disgraced. But we would send the children. If the girls got pregnant up north, they were sent down south to take care until they had the baby. If they were in the south, they were sent up north until they had the baby. The whole huh?
Well, they in DC they had schools for girls who were pregnant.
Oh, yeah. Okay, but in the olden days too, Carol, when you got pregnant, you got married. That was the solution. You got married. So you wouldn't have to be brought before the church or whatever. You got married. That still doesn't mean that you weren't having sex. You got married. So
Well,
they
sometimes
did,
those
each culture did what they felt was necessary at that time. But my thinking is, when as a teenager, that's on your mind. It's that's part of the process, I guess, as far as hormones and different your body.
Your friend.
So yeah. But
like
back in
Lucy
the day,
said,
you got married.
it's like breathing.
Like breathing.
Go
Amen.
back a little further, and they used to stone the women for having sex outside of marriage, and they would be sticking up out of the ground from the waist up. And so they were throwing rocks at their breasts and everything, whereas the men had their arms free and they could block some of those stones. That's way back in the day.
Well, okay. Are there any other comments to share before we leave this article? This has been very generously shared. Any other comments? If not, let's go to the next article. It successfully covered an issue that the churches have dealt with in a very interesting way. Because I recall seeing many sisters being excommunicated because they had sex before.
Speaking of that too, I know one of the members of our church, when she was in charge of Christian education, she had me teaching the younger women, weren't any men in the class, but she had me teaching the younger women about the process and contraception and stuff like that. So the church was trying to maybe get ahead of it, I guess, but Dr. White was having me teach a class about
See it where? Oh, this one right here.
That
not,
was very progressive in those days.
yeah, it was.
Yeah. This is something that meat consumption is linked to higher type 2 diabetes, which is not surprising these days, but they've done studies that make it clear that meat, unprocessed or unprocessed or otherwise, is shown to increase type 2 diabetes. And this is to no surprise. Processed meat has been associated with so many negative things. It's amazing that steak and all those meats are so popular. But this is just another evidence that processed meat is dangerous. Any comments? We've said this so many times, it's almost like reading
There have
here
been
now.
there have been some articles over the last month that says that ham is the worst culprit, that a ham sandwich a day can increase your chance for type 2 diabetes by 15%.
Any other
Man,
comments?
love name.
Okay, let's go to the next study then.
I didn't want to stay on this one too long.
Matter of fact, I don't recall a time when we've not talked about processed meat. This is a different article that talks about bacteria-resistant antibiotics and the fact that there's now a special test they can do to identify when you have bacteria that are resistant to antibiotics. It becomes very important because if you treat somebody who has bacteria infection, septicemia, and the medication and the bacteria are resistant, then the patient will die of sepsis. One is antibiotics inappropriately, and using antibiotics for viral infections and other things like that predisposes to bacteria-resistant infections. And bacterial resistant infections are associated with people dying from their infection. And so trying to find bacterial heteroresistance by any test that we have, which now we have a test that does that, becomes important because septicemia is still a term that means that you have infection, and an infection that can be lethal. And that's the essence of what this article is all about, is that having bacterial-resistant infections means that you will likely die from an infection that could otherwise be treated. Septicemia, or infection, is still one of the leading causes of death in this country. There's no additional comment. Let's go to the next one. This is an article that is about the fact that transfusions, the most misinterpreted setting in medicine, is an article on transfusions, and suggesting that you need to be transfused if your hemoglobin is less than 9. And this article is very critical, because that's one of the reasons why transfusions are necessary. But there are other reasons, and sometimes people have increased heart rates, low blood pressure as a consequence of needing blood transfusion. And since it's clear that one of the most important donation you can give is a blood transfusion, and blood transfusion save lives. And sometimes in people who have myocardial infarction, unstable angina, and other heart diseases, sometimes even when the hemoglobin is higher than 7, you may need to give blood. And then, of course, with active bleeding, you don't use that as an indication, because it takes too long for the hemoglobin to demonstrate that you have anemia. So you have to give it regardless of what the hemoglobin is. And so that's what this article is all about. Some would argue that this is important for doctors, but it's also important for you as a patient to recognize that you may need a transfusion even when your hemoglobin is higher than 7, because there are other mitigating circumstances. So it's not just for doctors to know it, but it's for patients to be aware, so that their doctor offers you a transfusion, and there are other factors other than your hemoglobin that are involved, that you should recognize that this is still good medicine. Any comment on this particular article? Getting transfusions is something that you can't get without the patient's permission. So then usually the doctor will talk to you before he orders a transfusion. And so that's why it's important for you to know about it. Next article, please. This is a very novel article talking about traveling to die. And there was an article in the Washington Post just the other day that talked about people who have indicated they do not want to be resuscitated. And this person was resuscitated in spite of their objection, and they became very bitter and complained. And now we have people, because there are certain states that allow for medical assistance in death, so that they have incurable diseases, and they go to different states, including the District of Columbia, they can be helped to die. And so that people go to different states and different countries to get help in dying when they are diagnosed as having incurable diseases. And there are 10 states in the United States, and then of course Switzerland and other countries that actually have a physician-assisted death or suicide. And so there's tourism even in where you want to go to die. So this is a new type of tourism. People have talked about tourism going to other different states and countries to get surgeries and medical treatments, but now when it comes time to die, there's tourism there as well. Any comment on this novel form of tourism?
Whenever I hear about this, my first thought goes to Dr. Kevorkian, whatever his name was.
Yeah, Kevorkian.
Yes.
He was a real before his time.
Yeah.
The difference is that he wanted it to occur for people who had incurable pain, and they couldn't do anything about it. And he lost, of course, but he was well before his time in terms of being a pioneer. Dr. Kevorkian meant well, and he tried to help those people who couldn't help themselves. Let's go to the next article. It's interesting. This article says to live long to get to know your toes. And it actually is talking about the people who survive are the people who are more flexible. And those people who have increased flexibility and respond to changes in their bodies, whether it's their toes or their mouths or whatever, they are more likely to survive than those people who are not flexible about health. So one of the things that brings to mind is the fact that men are relatively inflexible in the sense that they don't even go to the doctor. So they know their bodies and know their health. Otherwise, they're going to continue to die sooner than women. But the more interested we are in our health, and the more we're interested in doing things that result in a healthier lifestyle, a better nutrition, healthier lifestyle, exercise, meditation, etc., the less likely we are going to die, the longer we're going to live. So this is a flexibility assessment issue, and getting to know your own health and being willing to be flexible about the changes that your health needs is a way of living longer. Any comment about this very interesting article that is on point in terms of the fact that, and it points out so well that men are dying faster than women because the fact that women are much more flexible with their health than men who won't even go to the doctor. Any comments about this a very important article? Although this is published in Scandinavia, it's just as important here as it is there.
Especially for Black men.
Yeah, especially Black men, you're right.
So all the women really have to do is clean their house regularly. They'll have plenty of exercise.
So true. Or go shopping. Yeah, it doesn't. Any other comments? I think we'll go to the next one, which may be the last article for the day. I've got to leave at 10:30. I think we sent out about 24 articles. This is an interesting article that is a good one to close on. This is a case in which this nurse had a double mastectomy, and after recovering from the surgery, they gave her the option of going home or going to a rehab center. And so she went home, and they got all the IV antibiotics at home, everything else at home. And one of the things about going home is that it's a relatively safe environment, free from other people and free from other infections. And so the question that people will want to go home and be treated, take the IVs at home and everything, in preference to staying in the hospital. I think it's a very positive article, which if you had an option, the better option would be to go home and be treated than to stay in the hospital. Any comments on this interesting look at the advantage of being treated at home rather than in the hospital?
Dr. Callender, I think COVID had a lot to do with this, because when I had my first hip surgery, it was March of 20, just before COVID. They shut the hospital down the next day after I came home. So I had to do my physical therapy at home. And the physical therapist, I just set up my phone at an angle so he could see me and instruct me as to what to do. So I think this kind of situation, the COVID helped them think about that. The fact that they had to come up with different ways of doing things during COVID. So I did all of my physical therapy for my hip replacement at home.
Wow.
Yes.
Amazing. Sylvia?
I also, the at-home care could be real beneficial. I know my mom, when she was in there, says, I got no sleep. I mean, she said, I could not sleep every time I went to sleep. Somebody came in there, poked me, needled me, moved me. So, sometimes you may be able to get more rest at home.
Very interesting. Any other comments on this new? I think your points about COVID have changed the practice of medicine completely.
Yeah, the other thing is they have more equipment at the hospitals. And
That's correct.
It seems like it would be more of an advantage to be around all of the equipment that they have provided for you at the hospital.
It depends upon how sick you are, because your point is well taken. If you're very sick, you need to stay in the hospital. On the other hand, if you are free of infection and all is well, your recovery could be better at home. But your point is well taken. If you're sick, you have any kind of complication, you're right, you're better off in the hospital. On the other hand, if you are in good shape, you could recover faster, perhaps at home. But of course, your relatives are paying the price, because they're the nurses who take care of you, as Sylvia pointed out.
Yeah, and if you got dementia, you might want them to stay where they are.
I have a question. That means if someone comes home they gotta have, they're not sending the nurses there or anything, so.
Yeah, they have nurses. Oh, yes. They do have nurses who come by to start the IV, to give you the antibiotics and those kind of things. So the nurse is not there full time, but the nurse comes on a periodic basis. That is required if you're going to be at home.
Oh, okay, so that's better. All right.
Yeah.
Yeah. That's mandatory that be connected with it. It's a good point, Carol.
Right.
And gives extra, I mean, as long as there's not extra work for the caregiver.
Oh, there's
Because,
extra work for the caregiver.
Well, it's yeah, it's extra
Yeah, there's
work,
extra-
and
but
you have to think about the patient is there, but the caregiver is going down the sewer.
Yeah,
I've
John,
been
yeah.
You know, of course, it's going to be wonderful for the patient, but who's going to give that extra time? And if they send a whole bunch of people, then the caregiver wouldn't have to worry about it. But that's more strain on the caregiver.
It is.
We said till death do us part.
I've been there, IV lines, the whole bit. I mean, if you're the caregiver and they send you home, and sometimes they think the patient will recover faster at home. And in most cases, the ones that I've been involved with, that's the case, but it puts a lot on you to be diligent. You have to do it.
Absolutely.
Yeah. What's that
Absolutely
famous
right.
phrase, Betty? Till death do us part.
Do us part.
You know, it's funny how the women take that seriously, but a lot of these men don't.
Okay.
Now, if they send home all the extra nurses and everybody else, even, you know, yes, it'd be good for everybody. But I don't see it that well for the caregiver, which, you know, I understand it's better for the patient.
Mhm.
In many instances, it's better for the patient, but if you have complications, then you should stay in the hospital. Okay, well, I think that's the last article for today, and thank you for your attention, and thank you, John Tatum, for doing such a good job. You and Carol pinch hit so well. Carol never says anything, even though she does so much.
Oh, John did it all this time.
Okay, thank you, John. Thanks, John. You did a good job.
Yes,
Thank you.
I